Welcome to our Monday team Zoom. I'm excited to share some things with you guys today. First of all, on the list, and I'm going to share my phone. And I don't know if you guys done all the training with
I'm excited to share some things with you guys today. First of all,
can you hear that?
I'm going to share my phone.
It's going on live on Facebook. Sorry about that, guys. I had both of those open. So, all right, I'm going to share a screen with you.
Very good.
If I could actually get there now. Oh boy. I should have had Kamiley do this for me. All right. I'm going to go with my phone here and we're going to go in the app. So if you guys want to, you can go in your app. Okay. Right here. So what you do is you look at type in, if you don't know, just type in personal care. And you see that already showing up. So this training on the beauty serum, I love this stuff. I got cleated on my leg playing ultimate frisbee, and it was this large apparatus is growing off my leg, and I put this beauty serum on several times. It was all red and everything inflamed, and now so much better. And then I love the what else do I love? I love all of it, but I mean, this is really cool. It's the stuff I use in the shower. Where's that stuff? Let's see it. Personal body care. Look, it's even in Spanish. I don't know how I got it in Spanish and English. But anyway, you just type in personal body care and you can get the training. There's like 3 trainings on it. Because remember this month, June, was when we're actually getting people able to order this. So I'd love you to get that training. Today, I'm excited to introduce Angela. I call her Wojo because it's really easy to say other than her last name, Wojtkowski. Did I do okay, Angela? Yes. She is, according to Dr. Beatty, she is one of the very best ICU nurses in the world, and I don't argue with that. She's very, very good, very knowledgeable. If you got a problem, you want her on your case, I'm telling you. She's the kind of person that investigates until, she proves that what she's doing is right. And that's the kind of person you want on your team. So she is Pro 3. And I would love for her to take over. She's going to introduce Dr. Beatty to you, whom we're excited to have today on this call. Go ahead, Angela.
Hi, thank you, Rusty. Well, I'd like to introduce Dr. Beatty. He did graduate work at UCLA in malariology and microbiology, graduated medical school in 1981, did a residency in internal medicine and emergency medicine at County USC, which is like the busiest, I think it's the busiest ER probably in the country. It's super busy. He did 16 years of emergency medicine, then moved to Tennessee and spent 23 years in internal medicine and
molecular medicine.
So how we met is I've moved to Tennessee and I'm doing home health nursing. He needed a home health nurse. So, and one thing I do when I do my admission is I review their medications. And in reviewing his medications, I noticed that he was on a lot of mitochondrial cofactors. And I was like, hey, you're on a lot of mitochondrial cofactors. And he said, you can't heal anything unless you start at the cellular level. So that was kind of the start of a great relationship. So with that being said, tell us a little bit about your recent health challenges and how oxidative stress played a role in all that.
Well, over the past, I guess 10 months, I've been fighting a sarcoma cancer. And that is the manifestation of what I would call carcinogenic stress, which includes oxidative stress, which we'll speak of in a minute, as well as DNA damage, protein damage, membrane, lipid damage, and mitotic damage. specifically in mitochondria, so that mitochondria cannot divide. And metabolic dysfunction, specifically a continually decreasing amount of ATP production from our mitochondria. And I liken that to a kid who starts out at 17 with an old muscle car, 500 horsepower and 8 cylinders. And in 5 years, he's down to 6 cylinders of power. And within 10 years, he's down to 4 cylinders. And by the time he gets to about 30-ish, he's sitting at around 1 or 2 cylinders producing power. And that is precisely what we don't tolerate. Mammals have got to be able to mitigate or adapt to stress from their environment. That's a law. And in that, I can illustrate that with my whiteboard here, specifically what oxidant stress is, because that's very foundational for our talk today.
And this goes into our next question as to tell us why you're excited about the activation capabilities that we have.
Right. Well, then this is my whiteboard. And I'm going to have to show that to you, and maybe you can hone in on that. Move up. How am I doing there, Rusty? And this shows us basically.
Back it up just a hair. Back it up just a hair.
Back it up. How's that?
More farther.
Coming.
Right there. Good.
Okay, good. And in this, we're discussing what oxidant stress is. If we then look at the graphic on the left-hand side, we see a large red column, which represents our cytoprotective mechanisms, antioxidant power. All right. And next to that is a small tower representing our toxic load at birth. So this is all at birth. And from the Canadian studies in Quebec on cord blood from newborns, we established that the average newborn had about 70 toxins at birth. Well, as we transition through to age 35, where we're dealing with all of the stuff that we should not have been exposed to, whether it be mercury in the amalgams in our mouth, or whether it's arsenic in the chicken that we're eating to plump up the chicken breasts, or the, I could go on and on, the glyphosate, the Roundup, the 2,4-D, all of the other organophosphates, they're bad guys. And on and on and on, we have an increasing load of free radicals being produced and flooding our system and damaging the cellular structures. So over on the right-hand side, we can see that the situation is reversed, so that the column on, I'm trying to make sure I'm not misquoting, the column that has now increased in size is the reactive oxidating species, or free radicals, are now way up. And our antioxidant power has gone way down. And this illustrates what oxidant stress is. As an oxidant stress is the point at which we have overcome and overpowered our antioxidant protective mechanisms. And now we are bathed in free radicals and we're in a landslide, in a tailspin. Okay, so that's where we are. Do
Okay.
I hope I didn't lose anyone.
Would you like to talk about something about the importance of NAD?
Well, NAD
How does that
plus, NAD
fit in all
plus.
this?
and-
I want to hear his story first.
Okay,
We didn't get his story, what happened to him, the cancer. We only want to hear that.
okay. Well, after almost 40 years in medicine, I retired with my wife in our practice in June of 2 years ago, almost exactly, in 2019. And spent a busy year on our property, on our farm, doing some pretty decent work, but then feeling more and more fatigued. I noticed a little nodule on my left shoulder over my scapula. Went to a good buddy of mine who's a good surgeon, and he didn't like it. He immediately excised that, and then found that we have a high-grade undifferentiated pleomorphic sarcoma. Well, what does that mean? It means that we got a bad actor which carries on average a 5-year survival of somewhere around 8%. So the fact that I had metastatic disease where I had a lung lesion and I also had a lesion in my T11 vertebrae was the reason that it was considered to be metastatic and therefore a grade 4 tumor. Cutting to the chase, having been run around the post by a couple of university centers with respect to gamma radiation and so forth, nothing was done for this tumor apart from Angela introducing me to Protandim in about the second week of October. So nothing was done from the middle of October during my surgery, following my surgery, until January, the first week of January, when I ended up with getting proton beam radiation to the vertebrae only. And then it was not until a month later, in April, that I started Keytruda, which is a checkpoint inhibitor immunotherapy. I won't bore you with that. It is a very good but very new immune modulator that has now shown to have significant impact on the tumor that I have and others. What can't be explained, in my estimation, and it's my supposition, that the only thing that was operant for 4 months was Protandim, and the proton beam therapy starting at 3.5 months, 4 months out, could not have explained how I suddenly lost the lung lesion, disappeared. The vertebral lesion was pretty much sterilized, but it did not account for an overall improvement in energy and in a host of different soft findings. And as a consequence, I told Angela that I honestly believe that as we will see with the data that's coming out from melanoma research in places like LSU and others, that this combination of 5 nutraceutical agents are actually stopping cancers. In the studies in melanoma, melanoma cells are prevented from going into a metastatic release and migration. I believe that what you all have your hands on, what you are responsible for educating the world about, is one of the most remarkable chapters in medical history in terms of the possible impact of Protandim on 200 different diseases. I won't bore you with, Randy will probably shut me down if I start talking about Robert Koch and TB, but 100 years after he made his announcement, Dr. Handler at Duke, teaching young professors such as Joe McCord in the 60s, he launched a host of new young scientists dealing with free radical biology and the quest for how do we turn around oxidant stress, and that daunting, meticulous, day in and day out effort in studying hundreds of different phytochemicals. They were able to determine that there was an improvement in sulforain, which is a broccoli-derived phytochemical. And by putting 5 agents together in a specific recipe, they were able to show profoundly increased antioxidant enzyme production following the introduction of Protandim.
Okay, Dr. Beatty, before you go too far from Dr. Koch, what picture is that right behind you there?
That's one of my heroes. That's actually Walter Reed and his very, very knowledgeable associate, Carlos Findlay, in Havana, treating malaria.
Okay, cool. So just to be clear, you would agree with Washington State University that NR2 may be the most extraordinary preventive breakthrough in the history of medicine?
Absolutely. I think it will eclipse Robert Koch's work on TB.
I think Angela was going to ask you, and maybe we got ahead of it, but you came out of medicine and you immediately kind of sensed that there was something missing. You're being trained by pharmaceutical funded education, but you realized that there's something. Mitochondria was kind of your first thing, if I remember correctly, when we were talking earlier. So
Right.
kind of summarize really quickly what was really missing, and then what has our nutrigenomic activation kind of filled in for you?
Well, I spent 20 years on my own time instead of using the clicker, reading molecular chemistry and genomics and proteomics and mitochondrial chemistries. And what was missing from all of that in the pre-2005 era was there was absolutely no unifying concept of how humans as mammals are able to adapt to the stress of oxidant reactive species. And I knew that that was absolutely missing. And I was pleased to find only through Angela, and it's not like I wasn't looking, but the peer-reviewed articles on NRF2 as of 2006, I believe were somewhere in the range of 60 articles. And today there are 18,000 peer-reviewed articles on NRF2. And how could that possibly be if it was not a real nugget,
Right.
a real gold nugget?
Yesterday when we were talking, Dr. Beatty, you said something that just, it hit me like a brick, the way you said it. You said something about ATP and mitochondrial function. What was that? Remind me what you said.
Well, there are few laws in mammalian biology and chemistry that are as profound as this, and that is, it does not matter what cell you are talking about in a mammal, in what organ, it does not matter. The truth is that the ability of the cell to survive and to do its job is directly related to its ability to mitigate the stresses that it's being bombarded with.
On NRT.
All right, so
My bad.
what I'm trying to say is cell repair is the most energy draining function that cells have to face. And cell repair is purely an ATP driven proposition. ATP being a product of oxidative phosphorylation after the Krebs cycle in our mitochondria gives rise to 38 ATP molecules per glucose molecule that has been metabolized. And that ATP is absolutely imperative for cells to continue to live through repair. And all that I have seen is has just ignored the fact that mitochondrial function plummets and continues to plummet to a point where we have profound metabolic disruption and mitochondrial failure in a lot of my patients. And we set about rectifying that before I was aware of the work of Joe McCord and his groups and his labs.
You told me something interesting, Dr. Beatty, yesterday. You said that when you had a patient come in and you're doing the workup, you wouldn't see them if they wouldn't let you do a full workup, you know, seeing what their mitochondrial function was, getting down to the root of the issue, not just prescribing pharmaceuticals.
Right.
Tell me how you said that again. What you'd say to a patient.
I did routinely. I did advanced lipid studies. I did Genova Labs, which is a fabulous laboratory system, and a lot of esoteric markers for pre-diabetes and other things. And I advise people, I can't help you without this. And so if you're not willing to go along with that, and some people weren't, I basically said, there's the door. I'm too old and I don't have that much energy anymore to fight with people. If you're interested, I can give you answers. No one else around here seems to want to know that. So I hope I'm not being pejorative, but that's how I approach things.
Yeah, you know, people are always, and I've been in this for 7 years, and people ask me, will it help with this disease? Will it help with that disease? Will it help with this problem? Well, has anyone heard of anyone helping with this problem? You're kind of taking us back to the fact that if you don't help the cell, you're not going to help anything. You want to just reinforce, reinforce that?
Absolutely. And if you take, for instance, since we have a new infusion or a new flood of Lyme disease in Tennessee, which previously was not here, we have a bunch of physicians who are Lyme illiterate. And we know that and it's not just Lyme, because there are 13 other terrorists that tag along with it, ehrlichiosis versus, on and on and on and on. And we can't make a change in that without Protandim. We need to turn on 400 life-preserving functions and 400 genes, which is exactly what the NRF nuclear cofactor, the NRF2 cofactor, becoming a nuclear factor, being released from the cell membrane by Protandim, allows it to do its function, and turning on what we consider to be the master gene for cytoprotective antioxidant response. So I don't know if I answered that for you, Rusty. But
You did. I just wanted, I think I interrupted and I cut Angela off. You had another question for him, is that correct? And I got a couple more.
No, he pretty much covered it. The one thing I did want to say is that he wanted me to remind him about is to thank Dr. Silverman.
yes,
So she really was able to talk to him at his level and explain things to him, as a, oncologist, pathologist, and really talk to him about his disease, what was going on, and nutrigenomics, and what this really is.
I would like to have been around in that conversation. That would have been over my head, but it would have been interesting, at least the part I could catch. So I have another question.
yes.
So, I mean, people love to ask this of physicians for sure. How do we reach our physician friends? And is it even optimistic? Should we be optimistic? What would let us know? I mean, I'm already pessimistic about it, but what would we notice about a physician that would make them be the person that might be open to this?
One is nurse practitioners and his PAs, or her PAs, because they typically are more receptive, and they have not entered the system wherein they're getting beaten to death with electronic medical records and with all of the nonsense that has gone on since 1995, where patients' health and the diagnosis of patients' illness has taken a back seat to buffing a medical record, electronic medical record chart. The NPs and PAs, I think, represent a significant new blood, if you will, who are not as, how shall I say, discreetly, not quite as proud that they know so much that they don't have to learn anymore. I remember that William Osler once said in 1900 that it's surprising with how little reading a physician can maintain a shingle. What is not surprising is how poor their results will be. That hasn't changed. That has not changed. And so putting down the beer and putting down the clicker and going to PubMed and looking at the research that is active is a part of our responsibility. I find that I know some DCs, some doctors of chiropractic that are excellent chemists and are very wired and very much accepting of and being able to understand the magnitude of what Protandim represents. So I recommend that you not necessarily try to beat on the front door of the doctor's office only. I'll give you an example with the advent of one of our best new agents for diabetes management, which happens to be a GLP-1 knowing the reps that were providing that, it became very clear that several docs who had no reason to be resistant absolutely would not even talk to them. It was their PAs and their nurse practitioners, however, that started using Ozempic, for instance. And as a consequence, the patients and the families saw such a remarkable improvement, whether it be in A1Cs or whether it be in the other molecular markers that we use, and weight, that they said if they happen to see their doctor and the doctor said, well, I don't know why you're doing this. And they basically informed the physician, if you take me off of this, I'm gone. You'll lose a patient. And that's when they started to pay attention.
Wow. Wow. So kind of a follow-up to that first question. If you're going to hand a study to a PA or someone without the GOD after their name, what study are you going to use?
What study am I going to use?
Yeah, if you're going to hand them a study, which one? You've read
Oh,
several.
man.
The Washington State, which one
The
would
Washington
you?
State, the Washington State study is very important. The circulation.
American Heart Association, that one?
Yeah, with Harm Bogart and obviously Joe McCord is on there as well. That's from American Heart, 2009.
Okay.
But there are just remarkable studies. For instance, from Antioxidants, the journal, studying protandim and its protective effects on nerve cells in MS patients. And with
Oh, yeah, that one.
Salt. And that is a very profound piece of work, because they were able to demonstrate so many things that were different with protandim being on board, and the NRF2 driven increase in protective enzymes, the SODs and the heme oxygenases and quinone oxidoreductase, and all of those, they are, it's remarkable how much they were able to pull together on this, showing that they could stop the damage to oligodendrocytes in brains, and that they could then turn on oligodendrocyte primordial cells to replace the
MS one.
oligodendrocytes that have been damaged. And
So that study, you felt as a physician, very, very intelligent physician, you felt like that was one that you really kind of honed in on as very.
Certainly, because in multiple sclerosis, there are very few studies that can show that you have suddenly turned on primordial, essentially stem cells, and directing them to become oligodendrocytes, which then can go in and then repair the damage that has been done to those nerve cells. And that's, having treated a number of those MS patients, that is big news. That is very big news.
Good. All right, let's see. What time is it? We're at, whoa, we already went 4 minutes over. I'm sure that those that, oh, Kamale, got your hand up. Let me make it available so we can actually ask some questions here before we get done. Okay, you can now unmute yourself and ask your question. Go ahead, Kamale.
I actually just probably accidentally hit that, but I could go on for days. Thank you so much for all of your expertise and your advice, Doctor. I'm thrilled to hear this. So Mahalo, mahalo, mahalo. And I guess maybe my question is personal. How are you personally feeling and how long have you been on our Protandim products?
Well, I've been on since probably the second week of October. And I'll let Angela answer the question because she has been my wound care nurse for my, as I call it, my saber wound, where I lost about a New York steak sized piece of my shoulder. And she has done a remarkable job of helping that come back together.
He was a great patient. Like, you know, just knowing that he had this basic knowledge, you know, that of cellular repair and our NRF1 and then, you know, researching the NRF2, it was great. The wound healed pretty rapidly, and he was open to some outside of Western medicine modalities to heal up and soften the scar tissue, which was really great. But the one thing I did notice is that when I first saw him, he would get stuck in his speech, and it would take a while for him to think of the word, like quite a while. And after 2 weeks of being on the Axio and everything, he was speaking like this. So I was like, wow, listen to you talk. Like, so that was within 2 weeks, and energy level really, you know, increasing. I had a hard time keeping him down. I'd heal this thing would heal up, and then he'd go out and carry a ladder on his shoulder, and I'm like,
tear it up
no.
again.
So he's really done great.
So it sounds like you're taking both the NRF2 and the NRF1 combined. Have you added in the NAD?
All three.
All
The
three,
NAD
wonderful.
As well as NRF1 and NRF2 and Axio. And I continue to take Mitocore and a number of the mitochondrial cofactors that I've used for some time. It's amazing that I'm now learning that NRF2 is stimulated by several of those cofactors, but not to the extent that it is with the proprietary blend of the 5 nutraceuticals.
Real quick, Dr. Beatty, we all want to know, you were gonna mention about NAD, and I totally interrupted you.
Well, NAD is an incredibly important product of the Krebs cycle. All right. And the ability for the NAD electrons, which are being shot out of the Krebs cycle, and they have to be caught in order to put them into the pipeline of oxidative phosphorylation. NAD is something that we can always use more of, NAD plus, and the ratio of NAD plus to NADH is important. But we know that the substrate for that oxidative phosphorylation pipeline is high energy electrons from NADP and NAD plus. Okay, and so you're giving this more energy to be used in the production of essentially 34 more ATP molecules.
So if I'm talking to a guy, would I be okay to tell him it's like turbocharging your engine?
Certainly, but more importantly, it is taking a rusted engine, which is functioning at the level of 1 cylinder, and is putting the most amazing Andy Granatelli oil treatment into that engine, and then bringing it back up to full 8-cylinder, 500 HP capabilities. We're undoing the damage that has been done. And we're doing that in our mitochondria. We're doing that in our cell membranes. You might, I won't go there. That's a side, that's a little bunny trail.
Okay.
T-bars are essentially oxidized lipid particles, and the ability to quantify how effective your antioxidant capabilities are is how much of a reduction can you show in T-bars. And as Dr. McCord discusses, he can show in 2 days a reduction in those bad guy T-bars, which
Yeah.
basically are junk in the cells.
Yeah.
And need to be gotten rid of. But you can reduce the production of those to the level of a newborn within 2 days of starting Protandim.
That's amazing. That's amazing. Man, if you could just read the chat, there's so many people with questions, they're excited. I think that we're all looking forward to seeing you on stage. I don't know about you, Angela, but I'm looking forward to hearing them on the stage, because they always have like at the events, they'll have a doctor's panel, science panel, and I can just see you on that panel. I don't know how many and anyone else here can see that, but I'm totally seeing that. I'm excited. I'm excited for our future as a team. I'm excited for the people that you're going to bless. You and Angela are going to bless through this. And like you mentioned, Lyme's, maybe some people forget, but this woman right next to you, you know this,
Yes.
was down with Lyme, and just incredible results in her life. And I only met her because a friend of mine knew Angela.
Right.
And because I said yes, Angela's better.
Amen.
But Angela just started one of her friends on Protandim, and she was an athlete, and she is just absolutely bedridden. And she is a Lyme patient and had absolutely no help from the Lyme illiterate physicians, which predominate in so many states. And what she was able to show, as you can describe,
Yep.
how this woman has absolutely turned it around.
Yes, absolutely.
And
Well,
that's,
we all thank you. I can speak for everyone else. We thank you so much for being willing to be on the call today. We're looking forward to a check-in from time to time, and as your story continues. And I just want to thank everyone for joining today. I don't usually close these out. I'm not used to this. So aloha from Zoom.
very good. Thank you very much.
Thank
Thanks for
you.
listening.